podcast where we bring bridge the gap between rare diseases, and patients, medical professionals, and the general public. I'm your host, Joanna, and today we have an incredibly insightful episode lined up for you. Our mission here is to connect patients with similar conditions, to share, to educate the medical community and the general public, and to seek out potential treatments and clinical trials from the 95% of conditions that don't have any FDA-approved treatment. Our guest this week is someone who embodies this mission in his work and personal life. Joel is the co-founder of Endurant Health, is here to share his journey and the innovative work he's doing with AI technology to diagnose rare diseases. Joel has a rich background, having previously worked with the National Institute of Health, and has a deeply personal connection to the rare disease community. His mother was diagnosed with Homocystinuria, a rare metabolic disorder. In today's episode, we'll dive into how Joel's AI tool is revolutionizing rare disease diagnosis, the challenges and triumphs he faces, and the future of AI in rare disease treatment. We'll also learn about the personal motivations and impacts his mother's diagnosis had on his career path. So whether you're a rare disease patient, a medical professional, or someone just interested in cutting edge intersections of technology and healthcare, this episode is for you. Let's get started. So Joel, can you tell us about your journey from working at NIH to the co-founding of Endurant Health? What inspired you to make this transition?
Yeah, absolutely. Well, thank you for the kind words. And I want to congratulate Joanna on her 1-year anniversary on this podcast, for our connection. So that's a big deal. Congratulations.
Thanks.
And the inspiration came in 2020. Actually, my sister was really sick, and at the time, and COVID was happening, and so previous to that, my mom had also been sick. We didn't find a cure for her for a really long time, so she was kind of in pain, and so 2 people in your family, and only me and my other siblings taking care of them. And so I've always been in love with science and the impact science could have on people's lives. So I decided I wanted to take care of my parents. We began researching on my parent and my sister. So began researching, what can we do? What do we have? What tools do we have at our disposal? And I found 2 other people, Emilio and Daniil, working on a similar problem. Daniil at the time also, his mom had a rare condition, and they live in Mexico. And so the medical system there is not as advanced as America, of course. And he also was working on a similar endeavor. And we were both approaching our problems that we were facing from a longevity perspective. So how do we help our parents and our loved ones live longer? And so initially, Endurant Health Span began as a longevity and kind of like precision AI tool for people who wanted to live longer. And that encompassed healthy people and other people who may be really into health optimization. But we quickly pivoted, seeing that we had parents who are facing these daunting diagnostic odysseys, inability to get proper care, even from institutions like Johns Hopkins, which they're incredible. So not many people could answer our questions, and especially with my mom and the pain that she had, the seizure she was going through. It was a very difficult time, and that's how Endurant Health spans from the rare disease perspective was born.
Mm-hmm. So, your mother was diagnosed with homocystinuria. How did her diagnosis impact your career path and your current work at Endurant Health?
Yeah, absolutely. So my mother was diagnosed properly in 2022 at the age of 48. So she'd lived with it for a really long time in her life. And I think she was misdiagnosed back in 2006. And at the time, I think I was 11 years old. And I told my mom, I'm going to become a doctor to help you with this. And so started on the path in med school. I fell in love with research, especially regenerative medicine, genetic variation diseases and stuff like that. Mm-hmm. And she had a seizure in 2019, I think. It was probably one of her worst ones. And we believe that she also had a mild stroke with a seizure. So they're one and the same. And that was the first, oh wow, I don't know how much longer my mom may have. We don't know what's happening to her. So quietly I began researching with the help of a NORD and Rare MD, a rare disease patient advocacy group here in Maryland. And that's what led to us finding her diagnosis. Knowing that, oh my goodness, she has HCU, knowing that late. But it took a lot of toll on her for, the first 50 years of her life or 48 years of her life, not knowing what's happening to her, constant seizures, having to stop work. And so my company's birthed out of, or our company's birthed out of, helping the people we love. And so it's a mission for us to find something to make it easier. And seeing the pains and, I guess, paths that people take to be diagnosed, to find treatment, to find help, and also living in darkness and in fear, and, the mental health impact that diseases or rare diseases can have on people. It's a real thing that we get to see firsthand as co-founders because we have parents and siblings and loved ones who are going through it.
Mm-hmm. So many of our conditions look alike. How can AI tell the difference between one rare condition and another? Like with homocystinuria, it's commonly misdiagnosed as Marfan syndrome.
Yeah, that's exactly what my mom was misdiagnosed with. And so the beauty of AI is its ability to learn minute patterns, its ability to see what cannot be seen by the eye. And because it's a machine translation paradigm, our body also has a language. And so if trained well, it can recognize the patterns of our body, the same language that our genetics speak, our DNA speaks, present themselves in diseases. And so therefore, AI can really help with recognizing specific disease patterns, progressions, and help us diagnose things faster and also finding treatment as well faster.
Mm-hmm. So you're not trying to eliminate the healthcare field. You're with this AI tool.
No. I don't think it's ever going to happen. Yeah. I think what we will do is, the goal is to democratize healthcare. So healthcare cannot be for the rich only. It cannot be for the wealthy or the people that have access to it. I think we are all entitled to proper and good healthcare. And so the idea is, with our tool, it's easier for you to, what we want is for it to be easier for you to not only have an expert readily available to you, but also ask questions, keep track of your own health metrics, and also empower you to be kind of the CEO of your health. you deal with this, and going to the doctor's office for 8 to 15 minutes at a time is not sufficient with someone that's living with a rare condition. And so you bring all your data with them, and so you don't feel like you're getting seen for the first time again by a doctor. And also, it gives doctors the ability to be more informed about who you are as a patient. It's a collaboration rather than they know everything. Because clearly, in the rare disease, people living with rare diseases, most doctors don't know how to treat them. And so they have to be able to collaborate with you in order to understand who you are as the patient. So we're not trying to get rid of them, but we're trying to make their jobs easier, actually. That's the goal.
Mm-hmm. So, what is the mission of Endurant Health, and what motivated you to start this company?
Yes. The mission is to obviously decrease the diagnostic odyssey, but also help people get to treatment faster. And so by helping everyone collect information that's prevalent to their disease, that diminishes the time it takes for you to be seen by appropriate doctors, get into clinical trials, and then hopefully find treatment way faster than the 8, 10, even 50 years sometimes that it may take. And the goal for us is to really democratize and reduce the burden and price cost that it takes to be seen as a patient. That's one of our biggest goals, and we know that information is important for rare disease patients. And how do we make information that's scientifically relevant, accurate, and also how do we give you and empower you to take hold of your own health that you've already been doing for a really long time on your own, but now you have something that maybe you can rely on to answer specific questions that you may have about your own health.
Stay with us. We'll be right back.
Welcome to High Street Matters, a regular podcast from BIRA, the British Independent Retailers Association. My name's Steve Dyson, and I'm a journalist who's interviewing top business owners and experts here at BIRA about issues which impact independent retailers today. We'll be talking to a cross-section of our members from around the UK, from single retail outlets to small chains, and from large department stores to leisure and hospitality. We plan to provide top tips to help businesses stay ahead of the retail curve. High Street Matters. Thanks for listening.
Okay. Can you explain how your AI tool works to diagnose rare diseases? What kind of data does it analyze, and how does it reach diagnosis?
Yes. Currently, our tool is not made to diagnose yet. It's to help diagnose eventually. But what we do is we collect a plethora of data. So from wearables, EHR data, your own personal journals, and how you're feeling on a daily basis. From that data, our AI analyzes that data over time, and there's a multimodal data that you can even take. So pictures of how you currently are, if that requires pictures. So if I have a rash on my body, I can take a picture of that. Today, June 13th, 14th, and that kind of data collection is then analyzed. And from there, we start to find trends, patterns, correlations that we can then save and keep, and then start to analyze, what does this look like? What pattern does this often follow? And even then, you could then provide the data that we've collected to your doctor. So Joel, or Joel's mom, has had XYZ presenting in the last 3 months. It seems like this is what they have. And so with that information, you take it to a doctor or your doctor, And now the doctor has way more information about who you are, what you've been facing in the last few months, really relevant data about your health. And then now, from there on, the doctor's able to either diagnose you or properly send you to the proper, or refer you to a proper doctor who can diagnose you at that point.
Okay. So, what are some of the biggest challenges in diagnosing rare diseases? How does AI help to overcome these obstacles?
Mm-hmm. So diagnosing rare diseases is notoriously challenging because of the low prevalence, the diverse presentations, and often non-specific symptoms. And so this leads to, long diagnostic journeys. Patients often visit multiple specialists, undergoing numerous tests, and in order just to receive an accurate diagnosis. And so the goal, the beauty of AI, I think its powerful nature is that it learns quickly and also understands deep patterns and can then able to help doctors faster. So in the past, it was, whatever perceived knowledge doctors would have from their training is all that we would have. Now they have what we're calling thought partners. AI is trained on all of data that's relevant to them, medical data, literature data. And not just that, with Endurant Health Span, we're also helping them with your data as well. So you're not just training on general medical literature data about rare disease patients, but it's also being trained on your own specific data. So now, those two things combined, you have a powerful tool that's able to help a doctor think through all the plausible and possible diagnosis that they may have for the patients, and that helps them make better, faster, quicker diagnosis.
Mm-hmm. Let's see. What kind of training or support do you provide to ensure that effective use of your AI tool by healthcare providers?
Yes, awesome. We're trying to offer comprehensive training programs, such as webinars. We'll be doing in-person workshops soon, and we'll do ongoing support from our clinical experts that we're trying to collect. And we're trying to also provide documentation and resources to ensure that healthcare providers can leverage our full AI tool while maintaining their clinical expertise and decision-making autonomy. We don't want to take that autonomy away from decision makers. We want to provide them a tool that can really help them make the best decision possible.
Future developments do you foresee in the use of AI for rare diseases? Are there any upcoming features or improvements to your AI tool that you're excited about?
Yeah, absolutely. I think the area of multimodality, where patients are able to self-report about their own health, and then that being integrated into AI systems within the healthcare. So it's not just about the AI learning from EHR systems and medical literature, but it's also learning about who you are and your longitudinal journey that you face specifically. So now the idea of personalized healthcare is no longer just, an idea or buzzword, but it can truly occur because the AI is trained on who you are personally, and what your journey has been, and how hard it's been for you to, and all the different challenges and problems that you faced over your health journey. And so that's a really powerful, and I think an advancement we're trying to make, and that's going to be coming down the pike soon.
What future developments do you foresee in the use of AI for rare diseases? Are there any upcoming features or improvements to your AI tool that you're excited about?
Yeah, absolutely. We envision our AI systems playing a crucial role in personalized treatment planning and disease management. Because most people, for a lot of rare diseases, they don't currently have treatments or cures. And so disease management is a really powerful and important problem that we're working on. And so by analyzing, different individuals' data, we can recommend tailored, approaches, therapeutics, predict potential adverse events, and then we can monitor your disease progression, and that enables us to be more proactive and effective in providing cares to people with rare diseases.
Beyond diagnosis and treatment management of a rare disease, do you see AI playing a role in personalized medicine or for rare disease patients?
Oh, absolutely. As I stated, I think by analyzing your individual data, AI is able to recommend tailored therapeutic approaches for patients. And being proactive and effective is now a possibility because we can predict potential adverse events more accurately and also monitor disease progressions as well. So yes, it goes well beyond diagnosis because it doesn't stop there from most patients who have rare conditions. It's about how do I manage my disease? How do I manage whatever the adverse effects that are happening to me? How do I lessen the burden of care for caretakers and the patient themselves? Absolutely. We think AI plays a much more, an even more critical and important role beyond diagnosis.
How has your personal experience with your mother's diagnosis influenced your work and approach to rare disease diagnosis?
My mom's journey with HCU has been a constant source of inspiration and motivation for me. It's really instilled in me deep empathy for the challenges faced by people suffering with complex and rare conditions and their families, and also how dark those times can be and how alone you can feel. For 48 years, she didn't know what she had. And so it was really difficult for her to have successful, good days. There are times that were dark for her. Times where she felt as if, is this the end? Seizures, the mild strokes. And they happen at inopportune times. I mean, no one wants a seizure, but, to get a call that your mom had a seizure on the metro is not something you want to hear ever. And no one there to help her. People were too afraid. And so, it drove me to find innovative solutions. It drove me into the research field because I've always wanted to help and alleviate the pain that my mom and other patients feel. And the more you see it, the more empathy you have for people going through these diseases who oftentimes do not have answers.
What advice would you give someone who suspects they or a loved one might have a rare disease?
Yeah. Oftentimes, I would say what we found is that patient advocacy groups and support networks are incredibly powerful. And so, most people have done a little bit of research or have a little bit of information from their providers about what they potentially have. And so if you start there, the advocacy groups were really instrumental in us getting a proper diagnosis for my mother. They led us to the right doctors who could potentially help her. And so that would be my number one advice for people who suspect that their loved ones may have a rare disease. And also, another thing is don't lose hope. I know it can be dark and you may not have all the answers to your question. and try to find doctors who are not going to dismiss you and dismiss your thoughts and opinions. Find doctors that are willing to work and collaborate with you in order to help your loved one find the proper diagnosis and treatment for their rare disease.
What resources would you recommend for patients, families, and healthcare professionals who want to learn more about AI and rare disease diagnosis?
Yes. So, National Organization of Rare Diseases, of course, is a leading organization that provides comprehensive information and support for rare disease patients and families. They also have a lot of information pertaining to AI in healthcare. Another one is A16Z. They're venture capital that invests a lot in the healthcare space, and they do a lot of incredible newsletters about how AI and healthcare, the merger between AI and healthcare, are really impactful, specifically in personalized medicine, disease diagnosis, including complex and rare diseases, and global gene as well. They offer educational materials, research updates, and advocacy resources to rare diseases. And of course, Endurant Health Span, we're going to be putting out newsletters and information and tools for both patients, clinicians, advocacy groups about how AI and rare diseases and healthcare systems and the payer's paradigm, all that will be included in trying to help people who have these conditions, caregivers, and provide more information and resources to them as well. So be on the lookout.
What is the one key takeaway you hope our listeners will gain from conversations today?
One of the key takeaways is I hope our listeners are excited about the potential AI has to revolutionize the diagnosis and management of rare diseases. But we have to implement this in close collaborations with healthcare professionals who have a deep understanding and unique challenge faced by both the patients and their families. And so that's a really important takeaway. Our job or our role is that we are trying to play as a company is to help and not take away the autonomy of doctors, but give that autonomy back to the patients and the providers as well.
How can our listeners learn more about Endurant Health and stay updated with your work? Are there any social media handles or websites that you could follow?
Yeah, absolutely. We're on all the socials: Twitter, Endurant Health Span, Instagram, Endurant Health Span, and we also have our website, endurant-healthspan.com, and also on LinkedIn. And we'll be providing newsletters, and you can sign up there on our website for any newsletters or information and inquiries or collaborations if you would like.
Jill, thank you for joining us today and sharing your incredible insights and experiences. It's truly inspiring to hear about the groundbreaking and follow on social media. The links will be in the episode description, and to also let you know, you can contact me through the link in the show notes. Also, if you're watching the audio version of this through text message. As we wrap up, I want to remind everyone that Rare Connection is about bringing together rare disease patients, medical professionals and the general public to foster understanding and support. If you have any questions or want to share your story, please reach out to us, and your voice matters. Thank you for tuning in to this episode of Our Connection. Don't forget to subscribe, rate, and review our podcast on your favorite platform. Stay connected with us and on social media, and stay tuned to our next episode. We are also there is a Facebook group and also a Facebook page for Our Connection. Where we'll continue exploring the world of rare diseases and the amazing individuals working to make a difference. Until next time, I'm Joanna, and this is Rare Connection. Take care, everyone.